Greetings, brothers. I am Dr. Ural Hill, and I'm your Health Committee Chair. And May is National Mental Health Awareness Month. This video was created to raise your level of awareness about mental health as Black men and for your families. We, for far too long, have fought the stigma of the use of mental health services in the Black community. As a matter of fact, for the past 30 years, I have been a part of that fight, and it's been far too long. And as leaders and members of Omega Psi Phi, it is our responsibility to uplift the community and to take a lead role on raising the awareness of mental health services. Over the last few months, our health committee, Dana Green Jr., Jamario McDaniel, Eric McClure, and myself, we have sought to lift our awareness about Black men's wellness. This has been our Black men's wellness year. And the areas that we chose were first, overcoming vaccine hesitancy, mental health, diabetes and nutrition, and raising the awareness about the need for the donation of blood due to the lower donation during the COVID epidemic. And we've also sought to just level the playing field as we participate and partner with the American Diabetes Association and the American Red Cross. These are two of our national initiatives, our national health initiatives from Omega Psi Phi. So today, I really want to thank you for supporting our journey here thus far. And as we go into the month, that's my buddy, that's one of my frat brothers over there, don't mind him. But ultimately, as we move forward in this year, June is a big month. On June 5th, quiet, Duke, quiet. On June 5th, we're going to have our virtual fun run, and it's the Eugene Davis Frosty Fun Run. His nickname was Frosty, and suddenly, without knowing that he had diabetes, in January, he had a diabetic stroke and died from it. So we're raising $2,500 and donating it to the American Diabetes Association so that we can raise awareness about the silent killer and how African Americans are twice as likely to get diabetes. On June 17th, in our partnership with the American Red Cross, we're going to have our inaugural annual Dr. Charles Drew blood drive right there in Ann Arbor at the American Red Cross. And then on June 19th, in our partnership with the University of Michigan Rogel Cancer Center, our own Eric McClure will be the mental health speaker on the Black Men's Wellness panel that will take place that Saturday morning from 9 to 10:30 a.m., along with other Black Greeks in the Panhandle, other Black Greek male organizations. And so it's going to be powerful, a powerful June, and we want to get you ready for it. Now we'll focus here today in this video. I'm going to bring you a general history of the history of modern psychology. You know, if you want to overcome a stigma, the first thing to do is educate, educate, educate. And so we're going to begin with Imhotep in Egypt and bring you up to today through biblical history, the journey of mental health, because it's a continuum. It didn't just start in 1878. It began with a Black man, an African named Imhotep. Now, the definition of mental health is a person's condition regarding their emotional, psychological, and social well-being. Remember that. Three things: their psychological, emotional, and social well-being. It affects how we think, how we feel, and how we act. It has biological factors as well. Our genes and our genetic predisposition for certain conditions, as well as our brain chemistry. For example, depression can be endogenous or exogenous. It can be brain chemistry or it can be situational. So our life experiences have a lot to do with our mental health and our family history. You know, if you want to look at a person's attachment orientation or how they approach relationships and their worldview and how they look at the world, boy, the personality is actually generally formed by age 6. And that was Sigmund Freud's philosophy. So, first of all, we want to look at our own genealogy and our own background to determine whether we see the glass as half full or half empty. And that makes a big difference in our success in life. And our younger brothers especially need to know that as they go out into the world. Now, if you want to know some symptoms or let's say signs of mental illness early, in your home environment, you can look at eating or sleeping too much, isolating from other people. Everything is social when it comes to mental health. Having low energy, feeling numb, flat or numb, irritability, if you're more irritable than you normally are, hopelessness and helplessness. If a person all of a sudden loses hope and faith in who they are and whose they are and what they can accomplish. If they're abusing drinking or smoking, and any fears or phobias that seem to get out of hand. So if you see those symptoms, try to get them to a professional. I have some tools, and there's some tools that are free, and they're in the public domain, and you can use the Beck's Depression Inventory in 15 minutes. It's a self inventory that you can pull up online, and a person in 15 minutes can tell where they are as far as clinical depression. There's the Beck's Anxiety Inventory, same thing. There's the Michigan Alcohol and Substance Abuse Test. You can pull that up, the MAST, or the DAS, the Drug Abuse and Substance Abuse Test. In 10 to 15 minutes, you can determine whether you have an anxiety issue, a substance abuse issue, or issue with drugs, of abusing or being addicted. And then there's the Holmes Ra Stress Inventory. You can pull that up, fill it out, because remember, we're talking about wellness, so everything is connected, body, mind, and spirit. So situations and activities that occur in your life in the last year can affect your physical health and your mental health. And you can draw a continuum based on the experiences that you've had in the last year on your propensity to get physically ill and have a mental, let's say an emotionally or psychologically induced physical illness in the next year. So I highly recommend those tools to get started. Now let's look at the history